Welcome everyone to yet another episode of It Takes a Village. My name is Derek Katwe and I'm here with
Moses Tiri.
Dr. Moses Tiri is a gynecologist and obstetrician specialist, and we are here to discuss matters concerning fertility. Dr. Tiri, thank you so much for joining us once again.
You're welcome.
My first question is, before we go ahead, we need to understand what actually this fertility thing is.
Yeah.
Yes, Dr. Tiri, talk to us about this.
So, fertility is basically one's ability to achieve a pregnancy. If you're a male and you can achieve a pregnancy, then people will call you fertile. If you're a female and you can get pregnant, people will call you fertile. When you have difficulty conceiving, male or female, then you will be called subfertile.
Okay. And then when do we get to infertile, now that you're fertile and subfertile?
Well, I usually don't want to use the word infertile because humans are really never infertile, but they're just sub. You're below the acceptable levels where you can achieve a pregnancy. And if we do a couple of corrections here and there, then you're able to achieve a pregnancy. So I don't want to use the word infertile. Let's use subfertile.
I think for majority of us, the word has always been infertile. So today we learn.
It's stigmatizing.
It stigmatizes.
Yeah, it stigmatizes and it makes people go into those small cocoons, you know, and we want to encourage everyone to come out and seek help. So it's better you use subfertile so that you don't stigmatize people.
Okay,
yeah.
Interesting. So, Doctor, talk to us about when should one consider to seek your services as a specialist in regards to fertility, male or female? At what point should I feel like, I think this is now a point that I should really, seek professional help in regards to my fertility?
All right. So the general definition of infertility, forgive me for using the word, is really the failure to achieve a pregnancy when you have unprotected sexual intercourse for a year. Okay. The definition covers up over 80% of couples who have regular unprotected sexual intercourse. Over 80% should be able to achieve a pregnancy in a year. Now, if you're less than 35 years old, male or female, okay, and you're not getting pregnant, you're a couple, you're not getting pregnant, you've had sex regularly 3 times in a week for 6 months. If you're less than 35, if you've had regular sexual intercourse about 3 times in a week for over a year and you're not getting pregnant, then you need help. However, if you're over 35 years, you're a female and you've had regular sexual intercourse, unprotected, okay, for 6 months and you've not gotten pregnant, then seek help. Don't wait for that year. That is the general definition in Google and all those literature sources. So it's dependent on how old you are as a female and the duration of sex.
Okay.
Yeah.
And then for a male?
Well, for a male, it's a little bit tricky, but because it takes 2 people to get pregnant, we do encourage that when you're seeking help, you go with that male that you've been trying with, because 50% of the time, we find the problem in the male.
50%?
Yes.
Of the time? Yes.
When we look at difficulty conceiving, 30% of the times it's a female problem. Another 30% of the times it's a male issue. Another 30 we don't know, or it may be mixed.